Hello friends, our today's topic erythrocyte sedimentation rate, that means ESR. Definition: when known volume of anticoagulated, that means citrated blood is 1:4 dilution kept in a graduated tube in a stagnant condition, the RBC form rulets which are heavier and sediment. The rate at which the sediment occurs is known as the ESR. Normal value: number 1, male 12 mm or less than at first hour 17 to 60 years. Number 2, female 19 mm or less than at first hour 17 to 60 years. Number 3, in case of pregnancy 48 mm at first hour, 62 mm if anemic. Factors controlling the Rulex formation: number 1, fibrinogen. Number 2, alpha 2 globulin and gamma globulin in plasma. Number 3, glycoprotein in plasma. Stages of sedimentation: number 1, Rulex formation, approximately 10 minutes. Number 2, sinking of Rulex, constant speed for next 40 minutes normally. Number 3, showing of the rate of sedimentation as the Rulex packs at the bottom of the tube for final 10 minutes. Method: number 1, Westergren tube method. Number 2, Winthrop's tube method. Number 3, Landau microsedimentation method. Number 4, zeta sedimentation ratio. ESR by Westergren tube method. Principle: when citrated blood 1:4 dilution in a vertically positioned Westergren tube is left undisturbed, RBCs aggregates stack together to form Rulex and sediment through the plasma. The ESR is the rate at which this sedimentation occurs in 1 hour as indicated by the length of the column of clear plasma above the RBCs measured in millimeter. Specimen: either venous blood directly into sodium citrate 1:4 dilution or EDTA mixed blood diluted in sodium citrate can be used. Reagent: 3.8% trisodium citrate. Equipments: number 1, Westergren tube. Number 2, Westergren ESR stand with leveling device. Number 3, sucker. Number 4, container. First of all, mark the container. After that, 50 mark of the Westergren tube. Take 3.8% trisodium citrate in the container. Then, after properly mixing EDTA mixed blood, take up to 200 mark blood and mixed it. After mixing, draw the blood to the 0 mark of the Westergren tube, avoiding air bubbles, and place the Westergren tube is the stand. Check the ESR stand is level. Set the timer for 1 hour. Exactly 1 hour, read the level at which The plasma meets the RBCs in millimeter. ESR increased in A. Infective tuberculosis, Kala-Azar in most of the chronic infection. B. Inflammatory rheumatoid arthritis, rheumatic fever, other connective tissue disorders. C. Neoplastic, multiple myeloma, lymphoma, paraproteinemias. D. Miscellaneous, aplastic anemia, autoimmune disorders, mixed connective tissue disorders. ESR decreased in A. Polycythemia, B. Sickle cell anemia.